If you're interested in knowing what should a hearing device cost you, this video is for you. We hear most commonly people talk about purchasing a hearing device, from an audiologist or from a hearing aid dispenser. Those are two really common ways. And so you have kind of brick and mortar spots. You've got places like hospital type settings. You've got standalone clinics that are like in a strip mall. You have different outpatient clinic facilities like ours that are, a building full of different specialties, and it feels medical and it is medical, and there's kind of a feeling of, I'm doing this in a very comprehensive, very, very secure way. But there's other ways to buy hearing devices.
Yeah, those are kind of the traditional ways. But, we live in a modern day and age.
I know.
Everything's going AI, everything's going digital, everything's on the internet. And you can buy hearing aids on the internet.
Yep.
There's
Let's talk
internet
about it, though.
ads. Yeah.
I mean, on the internet, you got eBay.
Sure.
You got Amazon.
eBay.
Hey,
yeah.
Everyone's getting involved, is what we're saying.
What about these German hearing aids?
That's right. You see, this device came from Sweden or Germany, and
new technology, just as good as the expensive hearing aids.
What about if you went to like a Best Buy, or you know what I mean?
Yeah.
So these stores that are full of electronic goods, what's another electronic good but dibbles and dabbles in a little bit of healthcare? Yeah. They've got the over-the-counter hearing devices.
There you go. So these are this new avenue, this new way of getting hearing aids. They're called over-the-counter hearing aids, and they are going to be much less expensive. That big question, the elephant in the room, what are they going to cost? Well, the nice thing about over-the-counter hearing aids is that they can be relatively inexpensive. Mm-hmm. Some of these over-the-counter hearing aids are selling for just maybe $100 a piece.
That's right.
And boy, compared to thousands of dollars, that's quite a difference.
Pretty big, large chasm, big, huge difference between those devices. So we're talking just $100, $150 for one device, up to, $4,000 for one. I mean, go from hundreds to thousands. So what's going on here?
Yeah, over-the-counter hearing aids are interesting. The idea behind them is similar to like reading glasses. The idea is you should be able to just buy it off the shelf with no professional help. You just go get it, you buy it, you put it on, and you go.
That's right.
And it's a cool idea, especially for people that have maybe a mild hearing loss. In fact, these devices are limited on how much gain they can output.
How much help.
Their power,
provide,
they're power limited, because the last thing you want to do is buy something over the counter, put it in your ear, and then get a hearing loss from it because it's over amplifying sound. So they're limited to mild losses, maybe 40 decibels of help. And these hearing aids can help people with more mild, maybe even a little bit of a moderate loss.
That's right. So we have over-the-counter devices that are going to be on the lower spectrum. But then we have these devices that have dual chips and can fit someone with a mild loss all the way down with super profound hearing loss, basically deaf, someone who's almost deaf. And so you have devices that are much more flexible. They call these prescription hearing devices or prescription hearing aids. So you have the over-the-counter hearing aids and prescription hearing aids. Prescription hearing aids have all kinds of features that you can play with, whether it's how much help per frequency or per channel. So that's kind of like a pitch tone. So across all the pitch tones, you can adjust how much gain or how much help you can provide to someone. And then they have filters and compression. You have all kinds of different things that you can adjust, even down to wind noise or quick sudden noises versus steady state noises. So there's all kinds of things you can adjust on these devices. And these devices cost a little bit more, but prescription hearing devices sometimes can be in the hundreds still. So, less than 1,000. And then they go all the way up to, about 4,000 for just one single device. So there's still a big, huge range of price when it comes to devices.
Way more sophisticated, right? So these prescription devices are mini computers that can be finely tuned, custom fitted to the individual's hearing loss, to an individual's anatomy,
how it feels.
But there's a cost difference, right?
Right.
So you can get the basic kind of over-the-counter, generic type device, or you can get the much more custom fitted, more expensive prescription device.
So is that all that's going into the cost? When you go to buy a hearing solution that you're hoping remedies and fixes your hearing situation, helping you connect better, improving your quality of life, is that all that goes into the cost? Is it just the device?
The cost is interesting, especially when you're talking prescription devices, because traditionally the cost of the device has bundled into it the professional service of the clinic where you go. And so oftentimes the cost isn't truly just the cost of the hearing aid. You're looking at the cost of the assessment, the cost of the selection, the cost of the fitting, the cost of follow-up care,
cost
the
of
cost
maintenance,
the cost of counseling, the cost of future follow-up visits.
And then do it all again when their prescription changes in a year and a half.
Yeah. So there's often that. Now, some clinics you may find have unbundled their cost of care, which just means they might show you a price tag on the hearing aid that's quite a bit less than what you might have been quoted elsewhere. But then the important thing is to know, well, what's the cost of the service? Because if I'm paying for each individual visit, if I'm paying per service, it's important to analyze and compare apples to apples.
Great way to break that down. If you're seeing a cost of a hearing treatment plan that seems way less than another one, it usually has more to do with not the device. It usually has more to do with the provider or the location you're going to and what they provide for service. So when you see something that's half the cost, it usually just means that service is not included, it's an unbundled approach, or the service that is being offered may not be worth a whole lot. It might be super, super limited, and so you're not really comparing apples to apples across all these places, all these locations and venues for purchasing a device. They may be very different in their methodology and their approach to just dispensing the device and how they service and how they help the patient.
Yeah, so for example, you mentioned eBay earlier.
Yeah.
Let's say I have a patient, they come in, we talk about hearing aids, we kind of select and settle on a set of hearing aids, and for example, let's say it comes up to $3,800. That's not crazy, that happens regularly. $3,800 is kind of the cost of this set. And they say, well, let me just go do some homework, let me go think about it. They go home, they Google this hearing aid, they have the name of it, and up pops an eBay quote for $2,200. And they say, hang on here, my doctor said 38, I'm finding it on eBay for $22.
Got a $1,600 difference here.
And it might even say something like brand new, never used, seldom used, First of all, you're probably looking at something that is used. If it's being sold on eBay, it's probably something that someone previously owned. So you probably are now not looking at a brand new product, you're looking at a used one. But then the big thing is it also doesn't come with service. Over the years, I've had patients show up with a hearing aid like this. They say, I bought this on eBay for $2,200.
Great.
Service the device.
Yeah.
And then they're surprised when there's prices associated with the fitting and with the follow-up care. Because now we're dealing with this unbundled approach. You bought the hearing aid separately, and now what you're paying for is service. By the time you add it all together, suddenly you realize you didn't save as much money as you thought.
With our calculations, individuals, and we love all different types of patients. If they come with their own devices or if they buy them through our clinic, in our situation, we have our service package unbundled. So it's actually, we can separate it. So it's very easy to do. But a lot of clinics like ours will have a package that you can purchase, kind of an annual pass, where you can come and have your devices serviced. You can have your all the counseling visits, all the professional help, the wax cleaning, everything done under an umbrella, and it's a flat cost. Like with our clinic, it's $530 per year, and it lasts, all year long. You can come as much as you want, just as if you had purchased the device through our clinic. But some people say, can you just do this, this, and this? And so we have those itemized things unbundled. And what we find with individuals who just come in once in a while for unbundled care and they never buy a service plan, or they don't really have a really good service plan associated with their purchase, they end up spending usually 30 to 50% more, so almost double what a normal patient would pay for service, just because they're trying to buy the device super inexpensively, but then they only go and seek out help when they think they need it. So every time they come in, it's this dramatic thing, and it requires multiple types of services, multiple counseling. You need to be with the doctor for multiple visits. It ends up being kind of a larger ordeal versus that person who just comes in frequently, comes in about every 3 to 6 months and has their device maintained and serviced, and they're getting the right counsel, they're getting the right education, so they truly understand how they work with their device, and they feel empowered, and they feel very comfortable with their relationship with the device and what it can do, what it shouldn't do, and all of those type of things. So the bottom line for us, in our situation is service is usually way less when you have purchased a device through a clinic. But if you do purchase a device from, say, a warehouse or an eBay, or maybe you go through a third party like your health insurance, a Aetna or United Healthcare or a Select Health, or any of these that have a third party kind of governing and managing the way you buy a hearing device. If you've gone through those avenues, it's okay. You can still come to clinics like ours, and we still service you. And usually I would say the annual service plans typically are going to be quite a bit less when it comes to the less in money, but also way more in value. You'll find that it's way more valuable. So
let me say, I totally agree that the best way to succeed with your hearing aid is get on a regular pattern of seeing your professional. Mm-hmm. And we find that that's easiest if you have a service plan where you can just go in and get the care. If you're paying per visit, I see the same thing. People don't want to come in. So they wait and wait and wait and wait and wait until the problem's really big, and then all of a sudden the cost of repair is really high.
And what about how they won't wear the device? Like if it's not working, they think, well, I can go in there, but they're going to charge me. Is my problem that bad? And then they start talking themselves into not being healthy.
Yeah.
So it's interesting.
You mentioned a couple other things that I think deserve exploring a little bit. As we're talking about different ways to get hearing aids, we hit over the counter, we hit prescription hearing aids. Mm-hmm. We've talked about prescription hearing aids that are bundled with service, maybe unbundled from service. But you mentioned insurance plans.
Yeah.
I think that deserves a little bit of a discussion. You mentioned warehouse stuff like Costco. I think that deserves a little bit of discussion.
Yep.
Let's talk first about these insurance plans.
Okay.
And then maybe we can get into the warehouses.
Right.
These insurance companies, many of you may have a plan like this. It's an insurance sponsored plan where your benefit is very specific. It's dictated by your insurance. Mm-hmm. We often refer to them as third parties. The reason they get that name is it's not us providing the hearing aid. It's not even your insurance providing the hearing aid. It's a company your insurance has contracted with. That's the third party. And there's several of these, and they dispense hearing aids, they give hearing aids. And many of your insurance companies have contracted with one group, one company that provides hearing aids specific to them. Mm-hmm. And often your benefit is a discounted cost on that particular hearing aid.
And you only get that discounted cost because you have that insurance.
Yeah.
And that insurance is contracted with that third party.
So sometimes that can be good. You can get a price that's pretty good on a pair of hearing aids. But there are some things to watch out for with these third parties.
This is the hidden cost, probably.
The hidden stuff. These insurance companies and their contracts with the third parties sometimes dictate the type of care you can get. They dictate how much you can be seen. Mm-hmm. They dictate exactly what product you can get. So suddenly your doctor's hands are tied. We can't, as your provider, necessarily choose the device we'd like for you, nor can we see you as often as we'd like and get you on one of these maintenance service plans like we'd like. So there are some things to be careful with.
Yeah, one of the things that I think is hard for us with these type of insurance plans that have contracted with a third party, these third-party plans can be a little bit difficult because they provide the product at a good cost, but then they also make it seem like in their contract with you, they make it seem as if you're going to need about this type of service and it's going to cost about this much. But the reality is they're not accounting for a person that has wax in their ears. They're not accounting for someone who has medical conditions like tinnitus or ringing in the ears or funny sounds that they're experiencing. There's a lot of different types of issues that people experience between their brain and their ears that they don't account for. And so when we counsel with patients and when we are trying to manage and help them through their individual experience, it can be a totally different cost type experience than what this contract makes out to be. It's not always a good alignment. And so when things are not aligned based on the expectation that you may have with your insurance company and now this new doctor or provider, that's when things can be kind of a hidden cost. There can be frustration costs. There can be expectations that need to be realigned type costs. And so it can be kind of tricky with the third parties. In fact, that's probably the trickiest type patients we see are not the warehouse people or the eBay shopper. It's this not straightforward third-party stuff.
Yeah, you can tell as doctors, as providers, it can be frustrating. Certainly, I'm sure for patients it can be. I'm interested to hear your experience. Are we off base here? Are we right? Are we wrong? If you've dealt with a third-party company, we'd love to see your comments. Tell us any good experiences you've had. Tell us any frustrations you've had. We'd love to hear your comments, your feedback to see if our take lines up with what you've experienced.
As a side note, these insurance companies, although it's not always straightforward with what they do and don't do with hearing devices, what they do a good job of is covering the examination.
Yeah.
So we've been very happy with when someone's trying to find out how much of an issue they have, a hearing issue, a dizziness issue, maybe it's ringing or funny sounds in their ears, the tinnitus. When it comes to just a very thorough evaluation, these medical insurance companies have the hearing aid benefit plan, but they also do a good job with the diagnostic testing. They cover those things quite well.
Yeah, and the upfront cost is usually a lot lower. In the long run, you may not save as much as you think, but the upfront cost is lower, and to a lot of people, that's appealing too. So, give us your feedback. So we've talked about over-the-counter.
That's right.
We've talked about prescription hearing aids at an audiology clinic, a brick-and-mortar clinic.
We talked about online.
Talked about insurance companies and their benefits. Let's go warehouse.
Another big one's the warehouse.
Let's
go. The warehouse typically is kind of a unique feeling. People talk about feeling awkward walking into a warehouse and seeking out health care. So you kind of have to get your emotional self in that place where, I think the mattress was cheaper here and I bought a TV a couple of years ago. Maybe my hearing aids will be cheaper. And you know what? I would say that Costco's probably right in the middle when it comes to cost. So they're not going to be your lowest way to buy a hearing device. They're kind of in the middle, and they're kind of in the middle when it comes to servicing a patient. So a typical clinic will set you up on a regimen or kind of a way for you to come back and give feedback and receive follow-up care and have your anatomy, have everything looked at, make sure everything is pristine, make sure everything is hitting targets, that you're hitting those prescription targets that we need to. That's not going to be Costco. But Costco's there for you. If you have an issue, you can call them and walk in, and I believe you can make an appointment, things like that. So the service part of it is unique. We here in this region and through most regions, you're not going to see a doctor of audiology. You're not going to see a hearing doctor in the warehouse. I have seen reported that in some very few isolated areas throughout the United States, there is a doctor of audiology that works and dispenses hearing devices in Costco, but the vast, vast majority are not that way. So you've got some limited services, some limited expertise when it comes to who's the individual taking care of me, but the price points, when it comes to receiving a set of devices, you're going to be right around $2,000 and up to about $3,500 when it comes to the warehouse.
And these are prescription hearing aids. Costco has prescription hearing aids.
Good point.
At a relatively low cost. My biggest concern is the same as yours, and that's the service. It's going to be hit and miss. It's going to be spotty. You may find some dispensers. They call them hearing aid dispensers or hearing aid specialists. Right. Some of them may be pretty good.
Yep.
And you might have a Costco local to you with someone who's so good and caring and knowledgeable. You might have a Costco close to you with a team that is constantly changing. You never recognize the same person. There's not a lot of caring service and, frankly, not a lot of training or perhaps competence. So it really is a bit of a gamble when it comes to the service. And that's to say nothing of the technology.
That's right.
The technology that's in Costco, the devices are not the highest end. They're usually a few years old.
Premium, yeah.
They're not made by the name brand manufacturers. They're usually kind of a second tier, which are still prescription devices, but they're not the top tier companies.
Not typically, yeah.
And then again, the technology is usually 2 to 3 years old, so it's not bad. It's just a little bit old.
That's right, and the technology typically that is really low in cost, like really quite low, is even going to be probably lower than or older than the 3 to 5. It can go even older than that, but they do have their Kirkland signature brand, and that's usually what they, I think, consider their value device.
Yeah.
And so, yeah.
Like most things, you end up kind of paying for what you get.
That's right.
When you're talking cost of hearing aids, if you're getting an over-the-counter device that you found on the internet that's $200, and then you compare it to a really high-end premium set from a name brand that has a clinic behind it with full service, maybe 2 computer chips in it, it's not surprising to hear that there's a big discrepancy in cost.
That's right.
But as a consumer, as a patient, we'd love to answer your questions if you have any about this.
Mm-hmm.
It can be a hard thing to navigate and try to figure out, well, what's right for me? What's best for me?
Mm-hmm.
And we try to provide that as doctors and talk honestly and openly with our patients about what might work for them. Not often do I recommend the very most expensive hearing aid.
That's right.
But oftentimes, what's right for somebody is also not the lowest end.
You know, Dr. Whitaker's bringing up a good point. In clinics like ours and other clinics, different than, say, doing it fast and cheap, is this idea of you can research, you can try, you can experience different levels of technology that have different service plans. And so that can be a really, really valuable thing for individuals to say, well, how would I know if I should purchase a device that has dual chips and has all of this wonderful, this filtering ability and compression and all these neat things that help the sound be so much more comfortable, so they say, as compared to something that's a little more basic. And we always invite people just to try them. Wear this device for 30 days, wear this one for 30 days, and then you will know which one you think you want, which one meets your lifestyle needs and the different listening environments that you encounter and dynamic versus simple listening environments. Which one is performing well enough for you and that you feel comfortable? And so that's something that I think is a really powerful idea is don't just be worried about cost, be worried about performance, because those two things, the cost and the benefit or the performance, is exactly what goes into the value of what you're purchasing. So if you want to have something that's devalued, you may not be happy with that product long term. You may have buyer's remorse. But if you have something that's valuable to you and meets a good price point for you, isn't that comforting to know that you can try it out, you can find out for yourself, and that you can make a really good investment on your hearing healthcare so that you're good to go for the next 5 to 6 years.
Most of us have had the experience of realizing, I should have done this the right way. I tried to cut corners, I tried to maybe save money, and I didn't do it quite the right way. And some things it's just worth doing it the right way up front. Of course, that depends on the individual.
That's right.
For some people that might be clothes or cars or, I wish I would have done this differently. But hearing aids are often that way, where to me, it's worth it just to do it the right way.
That's right. And how many times do you have an individual that's been at the warehouse, now they're here, or maybe they've been shopping with their third party, their insurance, they're trying to figure out how much should they spend on their devices. In clinics like ours and doctors of audiology like us, we're always trying to find a solution that's $400 per ear or $800 per ear, and having technologies that might be a little older, but still can be very valuable for individuals.
So one pitfall that we've run into with these insurance programs, with these third-party insurance programs, is that they often will dictate the length of time that a patient can come in and get service.
That's right. So for example, the beginning is almost always the same. You have a fitting that's paid for by your insurance company, and then you get 3 to 4 follow-ups. That's most of the third-party companies deal with this. And
occasionally a year.
And that's what I was going to say, is I can think
year.
of one that gives a full year, but then after that...
But even with a year, it's usually 3 or 4 visits, honestly.
That's right.
The provider, scales that a little bit.
Scales that back. So you're dealing with a limited kind of a shotgun start where you're not getting probably enough visits and enough service to get yourself on the way and doing well with hearing devices. But that's what the third party is willing to pay, are just those first few visits, and then after that, you've saved money up front, and usually that's the bonus, is that it is cheaper up front, but then here come the service visits, and here comes the counseling, and for you to be happy with your device, you're going to need service, you're going to need maintenance and follow-up care.
So you're telling me if I get this plan, I save some money up front, I go through 3 visits, those are all covered by my insurance, but then I come back to see you, say 6 months later,
That's right.
It's my 4th visit, and suddenly I'm being told by the staff and by the front desk that, oh, I'm going to have to
It's gonna
pay
be 65
how
for
much?
this and 130 for that.
And then and it ends up
wax
being
cleaning's not covered. And
so suddenly I'm paying like $300 for my visit.
boom, 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 boom.
And guess what just happened? I just had a horrible experience. And I just say, I just got ambushed by a whole bunch of costs that I wasn't expecting.
Wait, I went from winning, I'm saving money, I feel like a winner,
so
and now I feel like I'm losing.
Now I feel like I'm losing.
What's going on
and
here?
if I continue to come back in and get the regular service, I'm going to pay that every time.
Mm-hmm.
And so after 2 years of doing that, now maybe I've got a device that I didn't pick, that my doctor didn't pick, that I haven't saved as much money.
Financially, you've spent more than you thought. Emotionally, you feel like, what just happened?
It's been kind of a rough...
How did I not see this?
Yeah.
You know, people say things like that.
So, yeah, we see that quite often, and we hate for our patients to have that experience of feeling like, gotcha, and now all of a sudden there's all these back-end costs. Now all of a sudden you're avoiding seeing us. Now all of a sudden you're frustrated every time you come in. That's what we want to try to avoid.
If you do choose to go with a third-party group and through a clinic that does third parties, make sure you have that conversation of the entrance of how I get into the device, and then what will it take for me to be successful. Go over that plan, and talk about how is the first year different than maybe the second and third year, and how is the fourth year very different than the first year. Go over those things with the provider, and they can kind of explain what the cost would be and what's associated. Another interesting thing is that the contract comes at us, and the patient can read the contract, and we read it, and it talks about services, but the services that are in the contract with the insurance company and with these third parties, they're very basic. It's minimal. And so a lot of the things that they're asking us to do is just clean and check the hearing device. But there aren't professional services included in this contract. And so you may think, $35 to $65 every time I want to clean and check, great. But what if your device needs to be reprogrammed and reset, and maybe your prescription changes because you went out shooting guns, or maybe you had a sinus infection, or there's a whole host of different things that can happen to someone, and those things are not included in your basic plan. And so there are some costs that your insurance company is trying to make it sound like you getting hearing devices is pretty simple, but the truth is you will need managed care, you will need help, you will need professional expertise, you will need maintenance like they're showing, but you also need professional help as well.
Yeah, so when we're talking about these costs, there's hidden little costs, there's long-term costs. It's good to ask your doctor, what kind of service plan can I get into long-term? And if we're talking dollars and cents here, it's good to know that usually these third-party programs are somewhere between $1,600 and maybe $2,000 up front. And then there's the hidden fees and the long-term service fees and things that are going to be added on after that. Yeah. It's also good for you to know as a patient, as a consumer, that money is all paid by you. The insurance company's not paying it. When you have an insurance benefit, what you assume is that your insurance company's paying some money for this. You assume I'm paying 20%, the insurance company's paying 80%. You might even think, well, my cost is $1,800, but I'm sure my insurance is paying my doctor. Nope. That's not true. You are paying the entire cost. It's more of a discount program than an insurance benefit. That's right. And it's all coming out of your pocket, and it's all the contracted, dictated by the contract that your insurance has with this third party.
Yeah, that's such a good point. When we first started doing third-party insurances, we recognized that they did a good job paying for the diagnostic testing and the evaluation and the counseling, but it was kind of almost a gotcha moment for us as providers that, they're not paying anything. They're just giving the patient a discount. And when you pay money to this insurance company, you're actually buying the hearing aids. So your insurance company has not invested $1 in this whole process. In fact, obviously you would think they're making money. Of course they are. So that's kind of an interesting thing, that there's really no benefit, because at the end of the day you're going to pay more for service. You're getting a device that's usually not a current device. Typically it's last year's model or 3 years ago model. And so you're not quite getting the right device, you're not getting the right service. What you are getting is a lower cost up front, but I believe you're probably getting a lot of costs down the road. And so if it's upfront savings you need, that might not be a bad option. But if you're looking for value and you're looking for experience and you're looking for, I want to make sure I'm not spending too much, and I want to make sure I'm getting the right help and I'm having the right experience, over a 5 to 6 year period, purchasing a device directly through someone that services it, or making sure you always have an annual service plan so you can come as much as you want and cover the needs you have, that's probably the best way to go.
You can tell we've got feelings.
We have opinions.
Boy, we got opinions on this.
We were just really going for it there.
Yeah, tell us your experience. Where did you get your hearing aids? What was it like? We'd love to hear from you. Let us know if you agree with some of the things we've said, and thanks for watching.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.